9 signs you're not staying safe during sports, ages 6 to 15. Sports are a fantastic way for kids aged 6 to 15 to stay active, build teamwork skills, and have fun, but playing unsafely can lead to injuries that sideline you from the game. Your body often sends warning signals when you're not protecting yourself properly, from bruises to dizziness to aching joints. Recognizing these signs early can help you avoid minor bumps or serious conditions like concussions or stress fractures. Backed by insights from sports medicine and pediatric research, here are 9 key signs that you're not staying safe during sports, along with practical tips to play smarter and stay in the game. Through examples like Lucas, Mia, and others, we'll explore how to spot these risks and make sports both fun and safe. 1. Frequent bruises or scrapes. Why it matters. If you're constantly covered in bruises, scrapes, or cuts after sports, it's a sign you're not using enough protective gear or playing too recklessly. Bruises and scrapes may seem minor, but frequent injuries can lead to infections or signal risky behavior that could cause bigger problems. A 2018 study in the Journal of Pediatric Sports Medicine found that proper protective gear, like helmets and pads, reduces injury rates in children by up to 40%. For example, Lucas, a 13-year-old skateboarder, comes home with new bruises every week because he skips knee and elbow pads. Signs you're not staying safe. You have fresh bruises or scrapes on your knees, elbows, or shins after nearly every practice or game. You play high-contact or high-risk sports like skateboarding, soccer, or hockey without wearing recommended gear. Your injuries take longer to heal, or you notice swelling or tenderness around bruises. The science. Unprotected skin and joints are vulnerable to impact, especially in sports involving falls or collisions. Repeated trauma can damage blood vessels under the skin, causing bruising or break the skin barrier, increasing infection risk. The Journal of Pediatric Sports Medicine study showed that children who consistently wore protective gear had fewer emergency room visits for sports-related injuries. How to stay safe. Wear protective gear. Use helmets, knee pads, elbow pads, and shin guards specific to your sport, ensuring they fit properly. Check gear regularly. Make sure your equipment isn't worn out or too small, as damaged gear offers less protection. Play within rules. Follow your sports safety guidelines to avoid reckless moves that lead to falls or collisions. Clean wounds promptly. Wash scrapes with soap and water, and apply an antibiotic ointment to prevent infection. Practical tip. Before heading out, like Lucas, do a gear check. Helmet, knee pads, elbow pads, and wrist guards for skateboarding. Ask a parent or coach to help ensure everything fits snugly, and keep a small first aid kit in your sports bag for quick wound care. 2. Sore muscles after every game. Why it matters. If your muscles feel sore or stiff after every practice or game, you might not be warming up or stretching properly, putting you at risk for strains or more serious injuries. Muscle soreness that persists beyond a day or two can indicate overuse or inadequate preparation. The American Academy of Pediatrics, AAP, emphasizes that dynamic warm-ups reduce muscle strains in children by 30%. For example, Mia, a 10-year-old soccer player, feels achy after every match because she skips warm-ups to jump straight into playing. Signs you're not staying safe. Your legs, arms, or back ache for days after sports, making it hard to move comfortably. You skip warm-up exercises like jogging or stretching before practices or games. You feel stiff or tight during the first few minutes of play, increasing injury risk. The science. Warm-ups increase blood flow to muscles, improving flexibility and reducing the risk of tears or strains. Without them, muscles remain stiff, making them more prone to micro-tears during intense activity. A 2019 study in pediatric exercise science found that children who performed 5 to 10-minute warm-ups had fewer muscle-related injuries compared to those who didn't. How to stay safe. Do dynamic warm-ups. Spend 5 to 10 minutes before playing with activities like high-knee jogs, leg swings, or arm circles to loosen muscles. Stretch after playing. Perform static stretches, like hamstring or shoulder stretches, for 5 minutes post-game to aid recovery. Listen to your body. If soreness lasts more than 2 days, Rest and tell a coach or parent to avoid worsening the issue. Build strength gradually. Increase activity intensity slowly to condition muscles for your sport. Practical tip. Follow me as lead by arriving 10 minutes early to practice for a warm-up routine. Jog in place for 2 minutes. Do 10 jumping jacks. And stretch your legs and arms. Keep a water bottle handy to stay hydrated, which also helps muscle recovery. 3. Sprains or twisted ankles. Why it matters. Frequent sprains or twisted ankles suggest that your footwear, playing surface, or technique may be inadequate, putting you at risk for more severe injuries like ligament tears. Sprains occur when ligaments stretch or tear, often during sudden movements. The Centers for Disease Control and Prevention, CDC, reports that proper footwear and safe playing surfaces reduce ankle injuries in children by 25%. For example, Ethan, a 12-year-old basketball player, twists his ankle monthly because his worn-out sneakers lack support. Signs you're not staying safe. You sprain your ankle or wrist repeatedly, even during light activity. Your shoes are old, loose, or not designed for your sport, e.g., running shoes for basketball. You play on uneven or slippery surfaces, like wet grass or cracked courts, increasing fall risk. The science. Ankle sprains result from excessive force on ligaments, often due to poor footwear or unstable surfaces. Repeated sprains weaken ligaments, leading to chronic instability. A 2020 study in the Journal of Sports Medicine and Physical Fitness found that children wearing sport-specific shoes had fewer lower body injuries, as proper footwear provides traction and support. How to stay safe. Wear sport-specific shoes. Choose shoes designed for your sport, e.g., cleats for soccer, court shoes for basketball, and replace them every 6 to 12 months. Check playing surfaces. Avoid fields or courts with holes, wet patches, or debris, and report unsafe conditions to a coach. Strengthen ankles. Do exercises like calf raises or ankle circles 2 to 3 times weekly to improve stability. Tape or brace. Use ankle tape or a brace during games if you've had prior sprains after consulting a doctor. Practical tip. Like Ethan, inspect your shoes weekly for worn soles or loose fit, and ask a parent to help pick sport-specific replacements. Practice standing on one leg for 30 seconds daily to build ankle strength and prevent twists. For feeling dizzy after hits. Why it matters. Feeling dizzy, woozy, or lightheaded after a hit to the head or body is a red flag for a possible concussion, a brain injury that requires immediate attention. Even mild concussions can have lasting effects if ignored. The National Institutes of Health, NIH, states that children in contact sports are at higher risk for concussions, and prompt reporting reduces complications. For example, Sophia, a 14-year-old field hockey player, feels dizzy after a collision but keeps playing, risking further harm. Signs you're not staying safe. You feel dizzy, confused, or nauseous after a bump, fall, or hit, even if it seems minor. You experience headaches or blurry vision after impacts, which may signal a concussion. You don't tell a coach or parent about head hits, assuming they'll go away. The science. A concussion occurs when a blow causes the brain to move rapidly within the skull, disrupting neural function. Symptoms like dizziness indicate brain injury, and continuing to play can worsen damage. A 2019 study in pediatrics found that children who rested immediately after a concussion had a 50% faster recovery than those who didn't. How to stay safe. Report symptoms immediately. Tell a coach, parent, or trainer about any dizziness, headache, or confusion after a hit. I'll wear proper headgear. Use a well-fitted helmet for sports like football, hockey, or cycling, ensuring it meets safety standards. Follow concussion protocols. If diagnosed, follow a doctor's return-to-play plan, which may include rest and gradual activity. Learn safe techniques. Practice sport-specific skills, like tackling or heading a soccer ball correctly, to minimize head impact. Practical tip. Like Sophia, memorize this rule. If in doubt, sit it out. After any hit, stop playing and tell an adult. Check your helmet's fit monthly, ensuring it's snug and not cracked, to protect your head. 5. Joint pain after playing. Why it matters. If your knees, elbows, or other joints hurt after sports. You might be overtraining or using improper techniques, risking overuse injuries like tendinitis or stress fractures. Joint pain in kids is often linked to repetitive stress. A 2017 study in the Journal of Pediatric Orthopedics found that overuse injuries account for 50% of sports injuries in children aged 6 to 15. For example, Noah, an 11-year-old baseball pitcher, feels elbow pain after games due to throwing too many pitches. Signs you're not staying safe. Your joints ache or feel tender after practices or games, especially in high-use areas like knees or shoulders. Pain worsens with continued play or returns quickly after rest. You play the same sport year-round without breaks, increasing overuse risk. The science. Growing bones and joints are vulnerable to repetitive stress, which can damage growth plates or cause inflammation in tendons and ligaments. Overuse injuries occur when training exceeds the body's ability to recover. The Journal of Pediatric Orthopedics study showed that children with balanced training schedules had a 30% lower rate of joint injuries. How to stay safe. Take breaks. Rest at least 1 to 2 days weekly, and take 2 to 3 months off from a single sport annually to allow recovery. Limit repetitive motions. Follow pitch counts, e.g., 75 pitches max for ages 11 to 12 in baseball, or similar guidelines for your sport. Use proper form. Work with a coach to ensure correct techniques, like throwing or kicking, to reduce joint stress. See a doctor. If joint pain lasts more than a week, consult a pediatrician or sports medicine specialist for evaluation. Practical tip. Like Noah, schedule rest days after intense practices, and ask your coach for technique feedback. Do a 5-minute post-game stretch focusing on sore joints, like knee bends or arm circles, to ease tension. 6. Getting tired too fast. Why it matters. If you feel exhausted early in games or practices, you might not be hydrated, eating well, or physically conditioned for your sport. Fatigue increases injury risk by slowing reaction times and weakening coordination. The World Health Organization, WHO, highlights that proper hydration and fitness reduce fatigue-related injuries in children by 20%. For example, Ava, a 9-year-old swimmer, tires out after a few laps because she forgets to drink water and skips breakfast. Signs you're not staying safe. You run out of energy within 10 to 15 minutes of playing, struggling to keep up. You feel thirsty, dry mouth, or lightheaded during sports, indicating dehydration. You skip meals or eat mostly junk food, lacking the energy for sustained activity. The science. Dehydration reduces blood volume, limiting oxygen delivery to muscles, while poor nutrition depletes glycogen stores, the body's energy source. Inadequate conditioning means muscles fatigue faster, increasing fall or injury risk. A 2020 study in Sports Health found that hydrated, well-nourished children had better endurance and fewer injuries. How to stay safe. Drink water. Sip 4 to 8 ounces of water every 15 to 20 minutes during sports, and drink 16 ounces before and after. Eat balanced meals. Include carbs, e.g., whole grain bread, protein, e.g., eggs, and fruits before playing to fuel energy. Build endurance. Train gradually with activities like running or cycling to improve stamina for your sport. Monitor hydration. Check that your urine is light yellow, a sign of proper hydration, before practices. Practical tip. Like Ava, pack a water bottle and a snack, like a banana and peanut butter, for every practice. Set a timer to drink water every 15 minutes during games, and aim to eat a balanced meal 2 hours before playing. 7. Skin burns or rashes. Why it matters. If your skin gets red, sunburned, or develops rashes after sports, you might not be using sunscreen or cleaning your gear properly, risking skin damage or infections. Sunburns increase skin cancer risk, while dirty gear harbors bacteria. The American Academy of Dermatology, AAD, states that consistent sun protection reduces UV-related skin damage in children by 50%. For example, Liam, a 15-year-old lacrosse player, gets sunburned during outdoor games and rashes from sweaty, unwashed pads. Signs you're not staying safe. Your skin turns red or peels after outdoor sports, indicating sunburn. You develop itchy rashes or pimples in areas covered by gear, like under helmets or pads. You rarely apply sunscreen or clean your sports equipment after use. The science: UV rays damage skin DNA, causing burns and increasing melanoma risk, even in childhood. Bacteria and fungi thrive in sweaty gear, leading to infections like folliculitis or athlete's foot. A 2021 study in pediatric dermatology found that children with regular sunscreen use had fewer signs of early skin aging and lower infection rates from clean gear. How to stay safe: apply sunscreen. Use broad-spectrum SPF 30+ on exposed skin 15 minutes before outdoor sports, reapplying every 2 hours. Wear protective clothing. Choose long-sleeve athletic shirts or hats to shield skin from UV rays. Clean gear. Wash pads, helmets, and uniforms after every use, and air them out to prevent bacterial growth. Check skin. Look for redness or rashes after playing, and tell a parent if they persist or worsen. Practical tip: like Liam, apply a sport-specific, water-resistant SPF 30+ sunscreen before games, and pack a small bottle for reapplication. Wash your gear weekly with mild detergent, and let it dry completely to avoid rashes. 8. Frequent falls. Why it matters: if you trip, stumble, or fall often during sports, your balance, coordination, or focus might be off, increasing the risk of sprains, fractures, or concussions. Poor balance is common in growing kids, but can be improved with training. A 2018 study in the Journal of Pediatric Sports Medicine found that balance training reduced fall-related injuries in children by 35%. For example, Emma, a 7-year-old gymnast, falls during routines because she rushes without focusing on balance. Signs you're not staying safe: you lose your balance or fall during sports, especially on uneven surfaces or during quick movements. You feel unsteady when running, jumping, or changing directions. You're distracted or tired during play, making falls more likely. The science: balance relies on the vestibular system, muscles, and proprioception, body awareness, which are still developing in kids. Fatigue, poor conditioning, or lack of focus impairs these systems, increasing fall risk. The Journal of Pediatric Sports Medicine study showed that balance exercises, like single-leg stands, improved coordination and reduced injuries. How to stay safe: practice balance exercises. Spend 5 minutes daily on activities like standing on one leg or walking heel to toe. Stay focused. Avoid distractions during sports, like chatting or looking away. To maintain awareness, strengthen core muscles. Do exercises like planks or sit-ups 2 to 3 times weekly to stabilize your body. Rest when tired. Take breaks during long practices to avoid fatigue-related falls. Practical tip: like Emma, practice balancing on one leg for 30 seconds per side while brushing your teeth daily. During practice, take 10-second pauses to refocus before tricky moves, like jumps or turns, to prevent falls. 9. Ignoring small injuries. Why it matters: playing through pain or ignoring small injuries, like a sore ankle or scraped knee, can worsen the problem, leading to chronic pain or serious conditions like stress fractures. Rest and early treatment are key to recovery. The American Academy of Pediatrics, AAP, states that addressing minor injuries promptly reduces the risk of long-term complications by 40%. For example, Oliver, a 12-year-old runner, keeps running despite shin pain, risking a stress fracture. Signs you're not staying safe: you continue playing even when you feel pain in muscles, joints, or bones. You hide injuries from coaches or parents, hoping they'll heal on their own. Small injuries, like bruises or soreness, worsen or don't improve after a few days. The science: minor injuries, if ignored, can progress to severe conditions. For example, untreated shin splints can become stress fractures, requiring months of recovery. The body needs rest to repair damaged tissues, and playing through pain disrupts this process. A 2020 study in Clinical Journal of Sport Medicine found that children who rested after minor injuries had a 50% lower rate of chronic issues. How to stay safe: tell someone. Report any pain, swelling, or discomfort to a coach, parent, or trainer immediately. Follow RICE: rest, ice, compression, and elevation for minor injuries like sprains or bruises to reduce swelling and speed healing. Rest adequately. Take at least 1 to 2 days off from sports if you feel pain, and return only when symptom-free. See a doctor. If pain persists beyond 3 to 5 days, consult a pediatrician or sports medicine specialist for evaluation. Practical tip. Like Oliver, keep a small injury log in a notebook, noting any pain or discomfort after sports. Show it to a parent weekly, and apply an ice pack for 10 minutes to sore spots after games to reduce swelling. What to do? Play safe, play long. Sports are all about having fun, staying active, and growing stronger, but playing unsafely can lead to injuries that keep you on the sidelines. By watching for these 9 signs: frequent bruises, sore muscles, sprains, dizziness, joint pain, quick fatigue, skin issues, frequent falls, and ignored injuries, you can take steps to protect yourself and stay in the game. Here's how to play safer, inspired by Lucas, Mia, Ethan, Sophia, Noah, Ava, Liam, Emma, and Oliver. Gear up. Wear helmets, pads, shin guards, and sport-specific shoes for every practice and game. Warm up and stretch. Spend 5 to 10 minutes on dynamic warm-ups before playing and static stretches afterward. Stay hydrated and fueled. Drink water every 15 minutes and eat balanced meals with carbs, protein, and fruits. Protect your skin. Apply SPF 30+ sunscreen and clean gear regularly to avoid burns and rashes. Focus on balance. Practice balance exercises daily to reduce falls and improve coordination. Report injuries. Tell a coach or parent about any pain, dizziness, or discomfort, and rest until healed. Listen to your body. Take breaks when tired, and avoid playing through pain to prevent worsening injuries. Get checked. See a doctor for persistent pain, dizziness, or suspected concussions, and follow their advice. If you notice any of these signs, don't ignore them. Talk to a trusted adult, like a parent, coach, or school nurse, about what's going on. They can help you adjust your habits, check your gear, or get medical advice if needed. By playing smart, wearing the right equipment, preparing your body, and addressing small issues early, you'll keep sports fun, safe, and rewarding for years to come. Start today. Grab your helmet, sip some water, and warm up before your next game. Your body will thank you, and you'll stay ready to score, sprint, or soar.